to recognize Commissioner Infante Green and her team at the Rhode Island Department of Health and everyone at the state level and the city and town levels who have been working so hard to make sure that our approach to schools is as healthy and safe as possible. For our part, one of the projects we've been working hard on at the Rhode Island Department of Health in supporting this effort is to create a COVID management protocol guide for schools. This will be a guide that schools will be able to use when thinking about how to prevent cases among students and staff and how to work with RIDO should a case be identified through testing. We intend to keep this an extremely close partnership in supporting education in the schools going forward. It really elevates the concept that as a state, we want to keep our eyes on the prize. The best support for our economy, for our society, for our children is getting our schools back and going. That's what we want to do, and that's why our discussions that the governor has shared today are in place to help us really stay focused on getting our numbers controlled, keeping them that way so that we can move forward as a society. Shifting gears as I usually do, I'll give an overview of our data. As the governor said, we have 84 new cases to report today. There has been some variance in our number of new cases since I was here last week, and it's important to pay attention to that because it's a key driver for the decisions that we're making. As the governor said, we are at a turning point. We had a day with our number of new cases in the 50s. We had some days in the 70s, in the 80s, and we have had days above 100 with case numbers around 120, even up to 130. Because of that, we want to make sure we're doing everything we can at this turning point to keep our numbers controlled. This is the moment where we have that opportunity to do that. To keep going forward on the data, we have our fatality numbers that have been somewhat lower over the past week, which is good. In the past week, we have had 3 days with no new COVID-19 associated fatalities. However, there are days when we do have new fatalities to report, like today, as the governor shared. We have 1 new COVID-19 associated fatality, and this person, sadly, was in their 80s. Our sympathies and our prayers are with this person's family and with all the families of those Rhode Islanders who we have lost. As I did last week and want to make sure we continue to do each week going forward, I'm going to give you an overview of what we are seeing in our case investigations. This way you have a clear understanding of the new cases we're seeing as we're studying them. That directly informs the types of interventions that we're talking about and that we know need to occur to keep our cases under control. There are a few common threads that we are seeing. One is related to travel. In the last week, roughly 12% of our positive cases reported recent travel. That has included travel to places like Florida, regional travel in the Northeast, and travel to the Midwest. As the governor also shared, Massachusetts and Connecticut and the other states in the region have put a travel restriction on Rhode Island. That's another way to make sure that we wake up and see where we are, particularly compared to the other states in our region, so that everyone continues to take this seriously. To share a little bit more about the differences in data that the governor had mentioned, one of the biggest challenges is that we have academic institutions and media organizations that are creating state-by-state comparisons because no organization in the federal government is stepping up to do this work. Thus, our surrounding states are relying on those numbers to determine what needs to happen for their states based on what they're seeing for Rhode Island. One of the issues is because we report numbers of people and tests, our numbers are not being compared accurately to other states that may only be reporting based on tests. This complication does not arise for many other states because they are not making this level of data, both people and tests, available. We are working very closely with the national organizations to help them correct how they are comparing our state data to other state data. Nonetheless, there are increases in our cases, as the governor has shared, and this is a turning point, recognizing that Connecticut, Massachusetts, and other states are seeing it. Another trend we are seeing is too many people are in the age range of 20 to 39, some a little bit younger, some a little bit older, that continue to be a challenge in terms of the cases that we are seeing. It's a critical point for us to work with people in those age ranges to really be able to take responsibility for their actions. We want to focus on keeping the economy going, on getting people back to school. That may mean that certain individuals have to make choices to simply wear their mask. Wearing a mask is the sole activity that all age groups can do and will make a difference. We also want to help people in this age group understand whether or not they might be positive with COVID and not have symptoms. That is part of why we are expanding our sentinel testing for asymptomatic people to those from 18 to 39 years old. If you are someone in that age range or near that age range and you're going to gatherings and not wearing masks, you're going to parties or locations not wearing masks, you're going to communities where case rates are higher, you are or your friends are, take advantage of this opportunity to go get tested. But remember this, it's helpful if the test is positive, because then we can work with you to make sure that you are isolating appropriately and that your contacts are quarantining appropriately and not continuing to spread transmission of COVID-19. If you are negative, that is just one point in time. It does not mean that you don't have to worry ever again about COVID-19. You could go to the next gathering without wearing a mask that same night or the next day and be exposed and be at risk for yourself or for the loved ones who are around you. So we encourage people to go frequently. You can go as often as you want to go and get tested. Be informed for yourself. That's a way to help you take responsibility for your actions to just wear a mask. If you're in this age bracket, you can sign up for a test at portal.ri.gov starting tonight. And people are telling us that they have been to gatherings such as family birthdays and barbecues or bars. That's where we want to help change behavior. Make sure that you are informed about not going to those places, crowding, and not wearing a mask, because that's exactly how cases are starting to increase. And if we don't make a change now, it would continue. But we have the opportunity now to make a change. Something else we're seeing in our cases is a reluctance in some instances to provide information with contact tracers when our Department of Health staff call to get information to be able to talk to contact tracers. Please know that the information we collect when doing contact tracing is kept absolutely confidential. Contact tracing, the ability to reach out to the people who have been exposed to someone who is a positive case, is a critical part of our work to prevent the spread of COVID-19. Our increase in turnaround time testing is also going to be critical. So a credit to the additional labs that will be joining with the RIDO State Health Laboratory that has been consistently maintaining the 48-hour turnaround time throughout this. The last important part of what we are seeing in our data is what's been mentioned. It's social gatherings, whether it's social gatherings at the beach, social gatherings at bars, social gatherings in barbecues, backyards, places of worship, events. If you are in a crowd without a mask, the risk of transmitting COVID-19 with or without you knowing it is extremely high. One of the final interventions that we are looking to do to help address that is to establish our community outreach reinforcement program. I've mentioned this in the past. We need this to expand statewide, and we need everyone to be involved with us. It's a partnership of all of our state agencies as well as with our municipalities. We need cities and towns to work with us, to support, restaurants to engage. The function we want to achieve is getting out into our communities and making sure that people are wearing masks, making sure that people have information about where they can go to get tested, making sure that everyone knows our social gathering size is 15, and you need to keep your groups stable, not change different groups of people that you're going to. We need each of you to contribute to getting that word out so we can continue to keep our eyes on the prize as a state. We're going to continue to build out this group so we can have more boots on the ground. There will be people in the community providing supplies such as masks and hand sanitizer, as well as giving education, reminding people that their gathering group sizes are too large. We're working hard to make sure that the makeup of this community outreach reinforcement program reflects the makeup of Rhode Island. So we need you. We need municipal leaders, we need faith-based leaders, we need everyone engaged in contributing to this process, getting out, giving out masks, giving out supplies so we can change our norm in Rhode Island together.